BMP Trephine Kit is used for the autogenous bone uptake in combination with coil BMP. BMP Trephine Kit is composed of the Trephine Drill 1, Trephine Drill 2, Trephine Drill 3, and implant site drills. Trephine Drill 1 is composed of the block bone guide and the block bone trephine of the diameter 6, 7, 8 mm in the inner diameter. The block bone guides have 2 mm protrusive the positioning center drill, which prevent the drill dislocation. The blade of this marks the guide circle for the block bone trephine. The block bone trephine has a depth index line of 3, 5, 7 mm. The block bone could usually be removed with trephine. If the block bone is not removed, the sharp instrument like elevator has to be used. It is better for the intrusive speed that the axis of trephine is turned in clockwise direction during reduction of bone. Clinical procedure for the particulated bone graft is introduced. For the defect of buccal and lingual bone in second molar, the block bone was taken in the reach of third molar. Block bone guide marked the guide circle for the block bone trephine. Block bone trephine drill was inserted into 5 mm from crest. The block bone was removed with elevator. The block bone was crushed for the particulated bone graft with the bone crusher instrument. The particle size was from 1 to 3 mm in diameter and the thickness was below 2 mm. In the defect, the particulated bone graft and coil BMP were filled, and the donor site was filled with HA-TCP bone graft. On 4 months after graft operation, implant was placed. On 7th month of graft operation, crown restoration was placed. On 3 years and 8 months after graft operation, the marginal bone was maintained. As a result, the defect of the donor site and the recipient site were regenerated with the new bone. Clinical procedure for the Audi design bone graft is introduced. For the deep defect of buccal and lingual bone in second molar, the block bone was taken in the reach of third molar. Block bone guide marked 2 guide circles, which were overlapped like Audi car mark. Block bone trephine drill was inserted into 5 mm from crest. The block bone was removed with elevator. The particle size was from 3 to 6 mm in diameter and the thickness was over 3 mm. In the defect, the particulated bone graft and coil BMP were filled, and the donor site was filled with HA and TCP bone graft. On 5 months after graft operation, implant was placed. On 8 months of graft operation, crown restoration was placed. On 3 years and 8 months after graft operation, the marginal bone was maintained. As a result, the defect of the donor site and recipient site were regenerated with the new bone. Clinical procedure for the block design bone graft is introduced. For the deep defect of buccal bone in first molar, the block bone was taken in the reach of third molar. Block bone guide marked the guide circles. Block bone trephine drill was inserted into 5 mm from crest. The block bone was removed with elevator, and the internal site of defect, coil BMP, were filled. The block bone was fixed with the mini screw in the basal bone of defect, and the donor site was filled with HA and TCP bone graft. And 3 months after graft operation, implant was placed and the immediate temporary restoration was lauded. The immediate crown restoration and 3 months of graft operation was well maintained without marginal bone loss until 4 years and 1 month. As a result, the defect of the donor side and recipient side were regenerated with the new bone. Trephine drill 2 is composed of the block bone trephine of the diameter 4, 4.5, 5 mm in the inner diameter. The trephine has the depth index line of 8, 10, 12, and 14 mm. The indication of the trephine drill 2 is the removal of the failed implant and the uptake of block bone in the site of implant placement. The implant and block bone could easily be removed with trephine. If these are not removed, the sharp instrument like elevator has to be used. In the defect of block bone uptake, the wider diameter implant than the outer diameter of trephine and the longer length implant than the depth of trephine could be placed. For removal of failed implants, diameter 4 trephine drill was used. The failed implant in first molar was removed with bone of sinus floor. In the removed site of first molar, the wider 6 mm diameter implant than the outer 5 mm diameter of trephine was placed. In the removed site of second molar, the longer 10 mm length implant than the 8 mm depth of trephine was placed in the sinus floor. Clinical procedure for graft uptake in the site of implant placement is introduced. For the defect of buccal and lingual bone in second premolar, the block bone was taken in the site of implant placement at first and second molar. The diameter 4 trephine drill 2 was inserted into 8 mm from crest. The block bone was removed with periodontal curette. The particle size was 4 mm in diameter and the height was 8 mm. In the defect of donor site, the diameter 4 and length 10 mm final drill was used. The diameter 4, length 10 mm Eno implant was anchored in the 2 mm step-up apical dense bone at first molar. But in the 2 mm step-up apical weak bone at second molar, the diameter 5, length 10 mm Eno implant was placed with condensing method. The particulated bone graft and coal BMP were filled in the buccal and palatal surface of implant of premolar. Clinical procedure of graft uptake in the site of implant placement for lateral bone augmentation is introduced. For the thin edentulous ridge in anterior teeth, the block bone was taken in the site of implant placement at first and third mandibular molars. The diameter 4 trephine drill 2 was inserted into 8 mm from crest. The block bone was removed with periodontal curette. The particle size was 4 mm in diameter and the height was 8 mm. Two implants were placed in the thin ridge of central incisors. The block bone and qual BMP were filled on the lateral wall of implants. The splinted resin bridge was immediately loaded with implant placement. On 2 years, 1 month after graft and implant placement, there was no marginal bone loss and mobility. As a result, the block bone and qual BMP showed an excellent scaffold function and a rapid bone regeneration. Trephine drill 3 is used for the plate bone uptake in the lateral wall of sinus and the window approach of sinus bone augmentation. This has 2 mm protrusive positioning center drill in the core, which prevent drill to dislocate. In thick lateral wall of sinus, Trephine drill 1 is adapted on the mark of Trephine 3 and get a palatal bone. If the block bone is not removed, the sharp instruments like periodontal curette has to be used. Clinical procedure for the plate bone graft is introduced. For the defect of palatal bone in second premolar, the plate bone was taken in the lateral wall of sinus. The Trephine drill 3 was adapted into the lateral wall of sinus, and Trephine drill 1 was inserted into the marked circle of Trephine 1. The plate bone was removed with curette. In the defect around implant, the plate bone and qual BMP were filled. On 4 months after implant placement and graft, the new bone was regenerated over the top of implant. On 3 years, 6 months after graft and implant placement, there was no marginal bone loss and mobility. The donor site was filled with the new bone at 5 months. As a result, the plate bone and qual BMP showed an excellent scaffold function and a rapid bone regeneration. Implant site drill and ecosystem drill could be used for the particulated bone graft in the site of implant placement. Without irrigation during drill preparation, implant site drill is worked in 20 rpm speed, and ecosystem final drill in 100 rpm speed. The particulated bone graft is accumulated at each drill operation. Clinical procedure for the particulated bone graft in implant site is introduced. For the fresh extraction socket in mandibular second premolar, first molar, and second molar, the particulated bone was taken in the site of implant placement. Without irrigation and drill preparation in the site of implant placement under 100 rpm speed, final drills was done. The particulated bone was saved from each drills. The particulated bone and qual BMP were inserted into the gap between socket wall and implant. And 3 weeks after implant placement and graft, the defects were filled with the new dense bone. On 3 months after implant placement and graft, the splinted crown was loaded. On 3 years, 5 months after graft and implant placement, there was no marginal bone loss and mobility. As a result, the particulated bone and qual BMP showed an excellent bone regeneration.